Pathology is the diagnosing of patients, whether it be fluid sample like blood or a tissue sample for a cancer diagnosis. Methodist receives patient samples from all the clinics, the hospitals, nursing homes that we provide services to. Last year we ran over 1.9 million tests. Dave is checking in specimens that have either come from clinics or the ORs, whether outpatient or the inpatient ORs. And he's checking in the computer to see what the clinicians have ordered, if it needs to go into micro, histology, or cytology. He's checking to see where it needs to get separated to. The clinical part of pathology here is extremely crucial to the hospital and the emergency room. To be able to receive specimens within a matter of almost seconds to minutes, processing it in a matter of minutes is extremely crucial to the patients. We are talking about probably life or death if we can get them started on a treatment plan versus having to wait. Hematology is our department that looks at your blood mostly. They will run your complete blood count, which most patients have had. They'll be looking at white blood cells, which is what Nancy's looking at on the screen. They can catch a lot of precursors to leukemia and lymphoma and alert our pathologists, who will then talk to clinicians and start getting a treatment plan for those patients. This is where all of the life-saving blood products are stored. Doctors will place an order for a blood product. They are supplying not only the hospital and our outpatient in the cancer center, they are also supplying Children's Hospital with all of their blood products. We're in microbiology, and this is where they send specimens to be tested for bacteria, viruses, and fungus. Another cool thing that they can do down here is they can actually take your bacteria from your body, can test it with specific antibiotics and other drugs to see if that bacteria will be killed, so they know exactly what to give the patients. After our assistants accession and create that barcode, the specimens will go to our PAs, which are pathologist assistants. They are the eyes for our pathologists here. They will read the clinical history, and they're going to look to see why the surgeon removed it, or if you had a biopsy removed at a clinic, they're going to try to help the pathologist figure out what happened to that patient. And then he's going to dissect that specimen so that he can see what's actually going on inside that specimen. And they pull all of the specimens and load it into an embedding center, and they use hot molten wax. They move it across a cold plate, slowly starts to solidify the paraffin. Bringing the wax block over a sharp blade, it's a fancy deli slicer, and it creates a paraffin ribbon. Water, it takes out the wrinkles that are in the tissue so that it's going to make a nice section on a microscope slide. These instruments that we have do the cancer diagnostic. We apply solutions to the patient sample and we can make it light up a color. The solutions that we apply on them, they not only tell you what type the tumor is, how far along the tumor is, but we are now able to tell you what type of treatment you're going to receive. We will consolidate the case and then we will walk it over to our pathologists so that they can look at it and start making their diagnosis. I personally love the challenge that even though all of our insides look the same, each patient brings a different challenge every day. Being a part of that care plan, we're one of the cogs in the wheel. So your nurses, your physicians, our pathologists, our PAs, all of us fit together to help give you the best treatment plan.